I would say I was definitely guilty of pushing off certain exams here and there with my busy life. Like, this is really important, so I'll get to that later, kind of a thing. And then that later and later did, become a couple of years. I have never had a colonoscopy before, and actually I did have symptoms. I had a little bit of bleeding, a little bit of cramping, and I would say, I kind of thought, well, it could be related to something else. I felt that with having these couple of symptoms that I was having, it was really important to get the actual colonoscopy. My primary care provider did refer me to Dr. Alisati after reporting the symptoms to her.
Colon cancer is the third most common cancer in the United States. It's the second in cancer-related death. In the screening world, we use an adenoma detection rate as a quality measure. Adenomas are one of the type of polyps that we see in the colon. The higher the adenoma detection rate, the lower the risk of developing cancer for individuals and for people. We're seeing more and more cases of younger people diagnosed with colon cancer, and we believe this is most likely related to unhealthy lifestyle. We're seeing obesity at childhood. It's all related to exposure to highly processed food. Now, other risk factors like cigarette smoking, red meat, excessive alcohol consumption, those are modifiable risk factors that we refer to, but then we have unmodifiable risk factors like genetic predisposition.
My dad's father, he had colon cancer, and then I went to liver and things like that. So he ended up actually passing of cancer in his late 60s, I want to say. So I do have that family component of it. I had some blood in my stool, so I ended up going to my general practitioner, Dr. Calamag, and I sat with him, talked to him. He said with family history that I had, he recommended that I go get a colonoscopy. He highly recommended Dr. Gamagami. He was great from the first second I met him,
Here you have a 42-year-old, he's having some rectal bleeding. He does have some distant family history of colon cancer, and that increases your risk about 2 to 3 times. But contrary to what we're used to seeing, Jason was an extremely fit. He's very active, and he's very involved, and he eats well. And you would think everything should be okay. But we decided to go ahead and perform a colonoscopy. I did a colonoscopy, and God behold, I found a rectal cancer. So right above where your lower part would be, a little bit higher, he had a large cancer.
I thought this was probably just going to be like internal hemorrhoids or some bleeding or a cut or something. Not a big deal. I didn't go into it thinking anything about cancer. And then I was shocked. I was scared. We scheduled the next appointment that we possibly could get with him. So we went and saw him the next day as soon as we got home. And that's when we found out it was cancer. It was rough. My wife was 8 months pregnant at the time.
It was so unreal to me. You know what I mean? You were kind of like looking at it from the outside. Like, here I was, 8 months pregnant. I couldn't breathe. My husband had cancer. He was young. He was healthy. It made me feel vulnerable. Like, I felt out of control. But there were so many more layers to his treatment. There were so many more doctors and questions. But, he did have a team, and they made you trust them.
We perform a high volume of procedures here. We were initially about 5,000-6,000 procedures a year at least at Silver Cross. Now, for the past 4 or 5 years, we have 2 more rooms in the outpatient endoscopy center. So with 6 rooms, we are performing even more, 7,000-8,000 procedures a year. So we have very high volume. Many of those are screening colonoscopies where we go in, look for polyps, take out those precancerous polyps to prevent it from progressing to cancer.
We have a disease that we can screen for, and we have different tools to screen for colon cancer, but the gold standard is a colonoscopy.
When we find a polyp, we can take out using a snare electrocautery. Snare is like a wire, circular wire that we tighten around the base of polyp, and using electric energy electrocautery, we are able to cut it off. So I have a lot of cancer patients that would have otherwise required surgery, but I was able to resect the tumor using endoscopic submucosal dissection technique.
It's very common that we get patients who are not interested in colonoscopy. Let's face it, who wants to drink a gallon or take a bunch of pills and sit on the commode the night before and have 20 bowel movements, show up to the hospital? It's not a pleasant experience. There's no question, though, colonoscopy is the best way to diagnose pretty much any ailment that has to do with your colon.
There is a missing rate with the other modalities that are available currently, more like a stool-based tests. Like Cologuard, FIT tests, they're good tests, but they don't compare to a colonoscopy.
Cologuard can miss cancer. Sensitivity is not 100%, and it can overdiagnose. So it can be positive and patient might not have colon cancer. If Cologuard is positive, you need to do colonoscopy anyway. 1 in 3 patients will require colonoscopy anyway. It's better to just get the definitive test in the form of colonoscopy, in my opinion.
And adding AI or artificial intelligence to it has been shown to improve adenoma detection rate. So the detection of polyps is improved by the use of AI, which leads to decrease in the risk of colon cancer.
Basically, it's a computerized intelligence system which is watching the colon images as we are performing colonoscopy, and it can see polyps few millimeters in size or flat polyps, very subtle lesions that human eye can miss.
So almost like you're providing the skilled endoscopist another set of eyes looking for subtle abnormalities and looking for polyps that you can detect.
AI does not replace a gastroenterologist, but it helps us make diagnosis more precisely and make diagnosis early.
I had a consultation with Dr. Al-Assadi, and I was set up with a colonoscopy that was within 3 weeks of that appointment. The day of the colonoscopy, he came in and he talked to me about what the procedure was going to be like. I just loved his demeanor. He made me very comfortable for the procedure. I came out of the colonoscopy procedure and I was still under anesthesia. So I started to come out of it. My husband was with me. So that's when he told my husband, and I was present too, that I had a cluster of polyps that he found, and several of them were on the larger side. Within a week of the colonoscopy, I did get the results that cancer was detected in 2 of the polyps, and 1 was precancerous. I think that when I heard cancer, I was a little bit not even believing it for a second. You know, that no, this can't be right. I'm not hearing cancer. Dr. Al-Assadi was very compassionate, and he was very quick to say, hey, let's get a plan going.
And one of the examples that we had of our patient, Yvette, where she noticed some rectal bleeding, immediately she came to us. She had a colonoscopy. Unfortunately, she had cancerous polyps, but the fortunate part, the cancerous spots did not go deep in the wall. And what we've done with the colonoscopy and resecting the polyps was enough to cure it. And her risk for cancer recurrence is very, very low.
My cancer care was at the University of Chicago Silver Cross. At first, I was, I got through radiation and I was doing radiation. I'm like, this isn't bad. I feel all right. Everything seems okay. And then I started chemotherapy. And after that is when I started kind of getting sick.
How we treat rectal cancer has changed. Back in the old days, if you had rectal cancer, you go straight to surgery, and then you got chemo and then radiation after surgery. Then we realized that if you did chemo and radiation before surgery, your cancer benefits in terms of cancer coming back or cancer going to metastases was lowered.
So I did 6 months of chemotherapy, and then I had about a month off, and then I had surgery. to remove the tumor. I had my entire rectum removed from Dr. Gamagami. He was amazing. I can't speak highly enough of him and the care that he gave.
I think it's fair to say that any patient needing colorectal surgery at some point should be considered for robotic resection because it's a minimally invasive way of taking care of the colon. We have a Da Vinci 5 robot system. It's the most up-to-date robotic system in the US. One of the nice things about the new technology is that you as a surgeon have full control of all the elements that go into a surgery. Let's go back to the pelvic area, which is important for a 42-year-old. You got to make sure you do what we call the nerve-preserving mesorectal dissection. Take the rectum, take the surrounding tissue. Make sure you don't damage any of the major nerves because you want them to maintain urinary function, sexual function, anal function. These are very important to any young person having major pelvic surgery. And with robotics, because it's such a precise way of doing the dissection, you can allow the patient to have very good functional outcome after surgery.
My wife was amazing through this entire process. And I have a great book that she created for me for Father's Day that goes through and kind of highlights all of the different activities that we did while I was going through chemo and while I was in radiation and while I was sick. So I get this every year for Father's Day, and this just happened to be the year of cancer. And we just try to keep everything as normal as we possibly could for the kids and try to keep their lives as untouched as possible, but with still creating some sort of compassion for people who are not doing great and sick like that.
Not only is he young, but he's a father of 3. But at the time when I met him, actually his wife was pregnant, I think, with their last child. So it's different when they're older because the kids are older, they're older, they've had a full life. But younger people have their life in front of them.
I just want to say how grateful I am for my entire care team, Dr. Gamagami, Dr. Golden, Dr. Mohammed, all the nurses, all the staff. Everyone was just amazing with their care, getting me through this. I am forever in your debt for keeping me around for my wife, my kids, so I can be here for them. So it was just truly amazing.
My husband's been my biggest supporter. He was always there for me to talk about how I was feeling. I got a few more calls that were, I love you. I got, some bigger hugs, a lot of really wonderful family time. And we really got together a lot more often. And you just really, really now understand what's so important in life. So, and they were really wonderful during this time period. The best advice I can give is that you have to take care of yourself first. If you don't take care of yourself first, you're not going to be able to take care of anybody else or anything. Don't ever ignore anything that your body is trying to tell you. And I'll tell you, the first time I started to have symptoms, I said, okay, there's something here. I need to pay attention. And that's what I want everybody to know, is to pay attention to everything. But then don't wait. And I wish that I hadn't have waited and put that off. And I had great news, but I don't know if everybody would have the same great news. And that's what I really want my children to do too. I want them to be proactive. I want them at 45 to get that colonoscopy, to get that early detection, so that they have a better chance of having the same outcome as me.
The colonoscopy is crucial. I definitely recommend getting it. Had I not gotten it, I might not have caught this, and I could be dead. I could be dead right now if I wouldn't have caught this. I was lucky. It was stage 3 for me. It could have been stage 4 a little bit later. Who knows? Go get a colonoscopy. Do not worry about it. The drink, you might have to use the bathroom for a little bit at night. Not a big deal. Go get the colonoscopy is what I would 100% recommend. It's not bad. It's not painful. The drink's the worst part. And it'll save your life.
I think there's no question, just getting a simple colonoscopy under sedation that removes the polyps and cures you of that potential cancer is far better deal than having to come and see me and get a major resection and getting chemo and radiation and have to put your family through an ordeal that they have such a journey of uncertainty of what's going to happen. So I always tell the younger patients, if it's not for yourself, do it for your family.